So with that, can I again sort of congratulate Minister O'Gorman on his appointment. Just say very close links, as you're probably already aware, between the DCYA and the SRI. We've been working very, very closely over many, many years now. So we have every expectation that we'll be seeing lots and lots of you, and we hope it's very useful to you. But it's great anyway that you're here with us today. So let me hand over to yourself, Mr.
That's great, Alan. Thanks very much. And look, I'm absolutely delighted to be here today to launch this report. It's the first time I've launched anything online through Skype, so a new experience for me here as well. I had the opportunity on Monday to meet with Merica and Emer and Helen, and we went through this research in a bit of detail, and that was really useful for me and my team, just to kind of be able to tease out some of the significant policy implications that are coming from this, I suppose, kind of overall summary of anything that's been done both on this particular pandemic here in Ireland and internationally, but looking at previous similar pandemics as well, and its impacts on various groups within children and young people. And I suppose we're still only re-emerging from the COVID crisis, but at this point we have to assess the available evidence to us as we respond to the crisis and look to actually rebuild our economy as well. And obviously we know everyone has been impacted by COVID, but that impact hasn't been felt evenly in all sectors. And I think young people have borne a disproportionate impact of the pandemic, in terms of when you look at the unemployment figures among young people, particularly the 18 to 24-year-old group, when you look at how many of them are renting at the moment and how they're specifically impacted. And indeed, the resulting impact on the economy and the recession will also have a specific impact on young people as well. But going beyond the economic impact, we also have to think about the social impact of this as well, and the fact that so many young people have been cut away from their friends, from clubs, from societies, from sport, and the mental health impacts that can have on them as well. I suppose we also have to be conscious of the fact that groups of children and young people who were already disadvantaged for whatever reason, that the impact of the pandemic has been particularly acute on them as well. So dealing with these issues will be a central role for me as Minister for Children, Disability, Equality and Integration, but it will also be a mission for the entirety of government. And look, for years, I think children were barely considered in public policy making, if they were considered at all. But that's changed. That's no longer the case. And this government, throughout the COVID crisis, have been very much focused on the impact of children and young people. And we have a job and a role to play now, particularly in the context of catching up as children and young people return to school, return to college, return to further education, and giving them those supports to allow them catch up on what they missed over the last number of months. And also then, of course, giving those supports in the context of the early learning and care services as well, both for the benefit it gives for young children in those services, but also for to allow parents return to work. This a piece of research today, it's part of, as Alan was saying, it's part of a partnership between DCYA and the ESRI. We're calling this the What Works initiative, to focus on key policy areas. And it's to make sure that policy making in my department and in other departments is evidence-based. And I know this is the first of a number of pieces of work that we'll be doing together, and I'll be looking forward to seeing those later pieces of work. But I suppose just to maybe talk, and I know the three researchers will be going through the various elements in detail, and I don't want to take away too much from their own presentations, but maybe just there are four broad domains that this research has been undertaken in. I might just briefly talk about some of the key findings in each of those, because they're particularly relevant to my work in this department and to other departments as well. So I suppose in the context of family relationships and the stresses that they've been under during the crisis, the research points to the impact of relationship stress on long-term outcomes for children and young people. And recent research indicates the necessity to combine work with that necessity in a lot of families where they're having to combine working at home with childcare. It's causing tensions to appear in families and in the interactions between parents and their children. And there's also emerging evidence that disadvantaged families and families with children with special educational needs are more likely to struggle under the current circumstances. And I think prior to COVID-19 research that was done at that point suggests that negative effects on the restrictions of seeing friends are likely to disproportionately affect young people from disadvantaged backgrounds, as they have larger friendship groups and rate them more highly. And I think we've seen from news reports and that the extended period of isolation is a particular risk for those families where there may be a history of neglect or particularly abuse or domestic violence. In the area of education, I suppose our key worry is that existing inequalities that exist in the educational system will be exacerbated by the closure of schools, of universities and places of further education, and the learning loss that has taken place because of that. And the research has shown that teachers and principals, particularly in DESH schools, are indicating that there's been a much lower level of engagement with the school across the period of the pandemic shutdown. And children of parents with lower levels of education were significantly less likely to report receiving resources from their teacher, the use of educational apps, or the use of the RTE's homeschool hub. And I think what we're seeing from the research is the importance of small group tuition to actually address that as children and young people come back to education. In the area of health and well-being, the international research indicates that there's been a very significant impact, psychological impact on children and young people across a range of symptoms, and that's similarly being indicated in research that's done specifically in Ireland. As regards physical health, I suppose we've all experienced maybe that drive to do that extra bit of exercise across the period of the pandemic. And I think what the research is showing is there's this kind of two-way system in that for some groups they've actually exercised more, but for another group, particularly maybe those who are less likely to exercise in the first place, the fact that they don't have the benefit of school and particularly sports clubs or PE through the school curriculum is actually having a significant negative impact on them. And again, the suspension of a lot of elective medical treatments and also various other services, and particularly those services that have along waiting lists, speech and language therapy, etc. Those waiting lists will only be increased because of the delays and the inability to access them during the crisis. As regards transitioning to further education and higher education and indeed employment, as I've already commented, the cohort of young people from 18 to 24 were particularly badly hit by the unemployment figures for unemployment there creeping to about 52% at one stage, and even by the end of June had only come back to about 45%. And I think international research shows that young people who are entering the workforce at a time of recession have longer term impacts on their subsequent wages and salary and their subsequent prospects within the labour market. And I think that's something we have to bear in mind. So thankfully and helpfully, the research also provides a number of policy proposals of things that can be done to address some of these areas. And look, this is something that the government is going to have to look at in a lot of detail over the next number of months. I know there's other pieces of research being done by the ESRI that will build out on this. I know my department, particularly on the mental health area, we've been working with the Spun Out organisation They've undertaken the How's Your Head mental health survey. We'll be getting the results of that soon. And we're also working with the SRI and others on a number of pieces of research, particularly looking at child poverty and measures we can take to deal with child poverty. So all of this research is going to funnel into the policy proposals. But just a number of quick things that I think I did take from this report. On the area of mental health in schools, the use of the Wellbeing programme, which is already built into the secondary school curriculum. And the Wellbeing programme is quite tailored to how various schools, the particular situations in various schools. And I would hope that, and I'll be talking to Minister Foley about this, that we can do some work within the Wellbeing programme to deal with maybe the stresses that young people faced over the last number of months, and particularly support them in that transition back to school after a very long period of being away from schools. I think we also have to look at additional supports, particularly for students with special educational needs, and I think that's something we really need to focus on. You may have seen that yesterday the Minister for Further and Higher Education proposed a package of measures to support the return to universities and colleges and places of further education. But particularly, he was placing a focus on the fact that if online learning is going to have to continue for quite a number of people, obviously there's an expense to that. You need a Surface or a tablet or a laptop, and particular funding for people from disadvantaged areas who don't have that sort of IT infrastructure at the moment. The July stimulus is going to be launched tomorrow, and obviously I can't talk in huge detail about its content, but I do know it is the supporting jobs, but particularly supporting employment among young people has been a major part of the discussion within government throughout this period. And even again at the cabinet meeting last night, it was an issue that came up. So I think targeted supports for young people who are moving into training, moving into education, and particularly supports for employers who commit to taking on young people and giving them that first step into the labour force, I think will be particularly important. And I know that from myself, but also from other departments, the Minister for Business, Enterprise and Innovation, all have been looking at measures that we can take to actually ensure that very alarming figure of 45% unemployment within the 18 to 24-year-old cohort is addressed as quickly as possible. So look, thank you for the opportunity to speak to you all today. Thank you to our researchers for their work on this. It's a really, really good piece of work. I'm looking forward to seeing more and more pieces of research being undertaken in conjunction between DCYA and the ESRI, and building a strong evidence base for the policies that this government is going to pursue over the next number of years. So unfortunately, I'm going to do that awful things that ministers do, give my speech and leave now. But look, as I say, I had a very useful session about this particular piece of research. So I'll hand back to yourself, Alan. Thanks very much.
Great, thanks so much, Minister. And obviously, we understand that you have to run, but as no doubt we'll see you again. And I mean, just a quick word. You covered an awful lot, but it's great. Always remind people there is an S in the ESRI. We've been talking a lot about the economics of the COVID crisis, and it's great to talk more about some of the social dimensions and the distribution dimensions. So really appreciate that. Okay, so let's move over now to the formal presentation of the report. So I know it's Helen and Emer are going to look after the presentation, and I think Emer is going to go first. So Emer, do you want to share your screen?
Yep. Good morning, everyone.
Again, I could do the thing of needs no introduction. So I think in your case, Emer, you need.
Okay, that's fine. So we're very grateful to the Minister for launching the report, and to the department for providing the resources and funding through the What Works initiative for this. As you'll see, we draw very heavily on the Growing Up in Ireland study, which was also funded by the department. So it's great to have that resource there already available. So just to give you an outline of what we're going to be talking about, I'm going to start by saying a little bit about the approach to the study, a short bit about lives of children and young people before the pandemic, and then I'm going to talk about the implications of the pandemic and its restrictions for physical health, for relationships, mental health and well-being. And Helen is going to talk about the implications for education and youth transitions, as well as the need for further research as the situation evolves. So in terms of how we went about the study, we wanted to engage in a critical review of research conducted before the pandemic, as well as emerging research in Ireland and internationally about the impact of the restrictions on the lives of children, young people and their families. And as the Minister said, we focused on 4 key domains. We focused on family and peer relationships, formal and informal learning, physical and mental health and well-being, and post-school transitions. So transitions to further higher education training and the labour market. Now, much of the existing research is based on online convenience samples. So they're quick, they're cheap, they're very flexible to respond to emerging issues. But unfortunately, the responses are often very selective. So they rely on people circulating links to survey through websites or social media. So often the group that complete these surveys are highly educated, digitally savvy, and they tend not to be representative of the broader population. There have also been really interesting rapid reviews based on pre-COVID studies. For example, rapid reviews of the effects of quarantine for illnesses like SARS or Ebola, and some interesting qualitative studies on specific groups. But in our research, we placed greater weight on studies that were based on representative samples, such as the CSO's Social Impact COVID survey, because that means we can generalize to the broader population and we can identify which groups are at risk of particular difficulties post-pandemic. Now, it's worth this context saying something a little about the lives of children and young people before this period. For this, growing up in Ireland, as I mentioned, is a really important resource. So we see some common features across all social groups in Ireland. We see positive, generally very positive parent-child relationships, and we see that parents hold very high expectations for their children's future, with the vast majority now expecting them to go on to further and higher education. But we also see patterns of inequality. We see that children and young people from more disadvantaged backgrounds tend to fare worse academically, so they've lower levels of social engagement, school engagement, academic performance and progression to higher education. On average, they have poorer health, lower levels of physical activity and higher rates of overweight or obesity. They also have greater socio-emotional difficulties and less involvement in the largely paid for structured and sports and cultural activities outside school that foster development more broadly. And as well as socioeconomic disadvantage, we see that particular groups of children and young people, those with special educational needs, travellers, migrants and asylum seekers, face additional challenges. So I'm going to start by saying something about physical health. We obviously saw a massive disruption in access to medical and dental services, including school-based assessments during the period of the pandemic restrictions. ESRI colleagues show a very marked decline in emergency department attendance, especially for children. So rates dropped by around a half for adolescents and just under 40% for children under 10, which was quite a dramatic decline. So this period of suspension of regular medical activity has meant implications for the continuity of care for chronic conditions and for growing waiting lists, especially as the Minister pointed out, in areas such as speech and language therapy, where waiting lists were already very long. And this period will have affected disadvantaged groups more than other groups because they have a greater prevalence of long-standing conditions at all age groups in childhood and adolescence and early adulthood. And as services resume, they lack the health insurance coverage to access treatment quickly. We also know from previous recessions that the economic shock of job loss and income decline has a negative effect on children's health. So altogether, the findings point to a further impetus for the rollout of Sláinte Care and the National Oral Health Policy, which were designed to address health inequalities. Now, Turning to diet and weight status, there's actually no specific information, interestingly enough, on children's diet during the restrictions, but we can draw some implications and insights from adult patterns. So the CSO found that there was a very marked increase in the consumption of junk foods and sweets in the immediate pandemic restriction period. So over 2/3 of the younger age group and half of households with children increased their consumption of these junk foods. Not surprisingly then, in the following month, just under half of the adults in households with children reported weight gain since before the pandemic period. And given that we know children's consumption is likely to mirror that for their parents, it's concerning that they're likely to have increased their exposure to unhealthy foods. In terms of physical activity, school is a really important arena for both physical education as a curriculum subject, but also for participation in extracurricular sports, whether team or individual. So the closure of schools and the suspension of other team-based activities meant a really strong impact on the lives of children and young people. For adults, there have been mixed results about the impact of restrictions. The CSO found that over 1/3 of adults said they increased their exercise, but a similar proportion decreased their exercise. Sports Ireland survey also points to increases in recreational walking. Now, unfortunately, we don't have any systematic evidence for children yet, but there's some suggestion from online surveys of younger children engaged in increased outdoor play, but also at the same time, concerningly, more screen time. Again, we expect the effects to be somewhat unequal because prior to the pandemic, more disadvantaged groups of children and young people were less likely to have a garden or to have a safe place to play locally. Our previous research has shown that over transitions, such as the move from primary to second level or from second level to the post-school period, can mean a disruption and a discontinuity in participation in sports. So there's a concern that this period of absence from organised activity will mean that fewer children re-engage when activities resume properly. Reduced income will also be a constraint for many families because of the largely paid for nature of these activities. Now turning to relationships, mental health and well-being. There are some positive aspects to the restrictions, of course, with almost half of adults indicating that being able to spend more time with their families was a positive aspect of the shutdown. However, at the same time, international research shows that there's been a significant double burden for parents, especially for mothers, in trying to combine working from home with childcare and homeschooling. And Helen will say more about homeschooling later on. Adults in Ireland report a significant decline in their satisfaction with personal relationships during the height of the restrictions. We know that younger children, especially those around 9, have really high levels of contact with their grandparents and extended family. And this is even higher among more disadvantaged groups. And all of that was disrupted by the shutdown and by physical distancing requirements. Worryingly too, we've seen an increase, a very marked increase in reports of domestic violence over the period of restrictions. Before COVID, we saw particularly strong peer networks among adolescents and friends emerging as a really important source of support for young people, especially those from disadvantaged backgrounds who tended to have larger friendship groups. These contacts, face-to-face contacts, were disrupted during the restrictions, but we have very little evidence on how or whether virtual contacts substituted for this and what was the longer-term impact on friendships. But existing online surveys of adolescents indicate that they feature missing their friends as a key aspect of the restrictions. Now, probably the largest body of work undertaken since the pandemic started has focused on the impact on mental health and well-being. International studies have shown very significant increases in depression and anxiety during the restricted period, with this increase being greater for younger adults and for women compared to men. In the UK, it's been found that there has been a greater evidence of deterioration for those with previous mental health difficulties. So the period of shutdown has exacerbated these difficulties. and job and income loss and living in overcrowded accommodation emerge as particular stressors. In Ireland, the CSO has found a very significant decline in life satisfaction among adults and marked increases in the percentage feeling depressed, anxious and lonely. And this would have been in April at the height of restriction measures. But even as restrictions eased in May, the Mark Tracker survey pointed to a significant minority of adults who said they felt anxious or worried a lot. And as with the international studies, we see the greatest decline in well-being among younger adults and among women. Now, before COVID, we saw a really strong link between parental well-being, especially maternal depression, and children's socio-emotional outcomes. So therefore, we would expect the adult patterns that we've discussed here to be mirrored among children and young people, if not amplified. And it's worth pointing to evidence of very significant impact of the disruption in routine and lack of access to supports for those young people with special educational needs. Now, the key issue is whether this is just a short-term impact in terms of well-being or whether there will be longer-term outcomes. It's hard to say, given that the scale of the impact of the pandemic is unprecedented, but we have good evidence internationally from previous natural disasters like Hurricane Katrina and 9/11, which point to longer-term effects on children's anxiety levels. ESRI colleagues have found very high levels of unmet demand for child and adolescent mental health services before the COVID period. So there will be challenges in the post-COVID world. Schools have an extremely important role to play in this respect. The Minister referenced the Wellbeing curriculum at junior cycle, and we have social, personal and health education at both junior cycle and at primary level. However, there is a gap there at senior cycle, with a need for those supports to be available for those students, particularly given their previously high levels of stress among Leaving Cert students. But some children and young people will have greater difficulties than others. So there's an important potential for access to therapeutic supports via schools, building on the previous provision by the National Educational Psychological Service and also through the school completion programme. A further factor that will influence the duration of the impact on children's well-being will be how long and how deep the recession is. If there is ongoing financial strain for families, it is likely that parental stress will continue to affect children's well-being in this respect. So I'm going to hand over to Helen now, who's going to talk about education and school work transitions.
Thank you, Emer. Thank you very much. So I'm going to talk you through the education impacts of COVID-19. Okay. So parents are obviously very concerned about the impact of the school closures and educational disruption. We see that about half are very or extremely worried, and 43% are somewhat concerned. When we've undertaken recent research, the ESRI colleagues have undertaken a survey of school principals at second level, and they highlighted a range of negative impacts. So this included student participation, that 3/4 are finding that this is worse or much worse, the level of student engagement, and also the areas which they thought were most negatively affected in terms of distance learning versus usual practice were things like group work and practicals. The amount of time that parents and children and young people are spending on homeschooling has also been looked at in some of the UK research and Irish research. What this highlights, I suppose, is the some of the differences depending on the methodology used to estimate or to look at these questions, as Emer outlined at the beginning. So we have an estimate from the Office of National Statistics in the UK, which is a nationally representative sample, and that says that that found that the average was about 11 hours per week, whereas an Institute of Physical Studies, which was based on a convenience sample, was coming up with a much higher estimate of 5 hours a day. In the UK, in Ireland, the estimate from parents is about 1 to 2 hours per day, but a fifth were spending less than half an hour a day. Now, that study didn't differentiate between primary and secondary schools, but I suppose the conclusion from that is that there is a substantial drop in the time spent on education compared to the normal school day. There is so far very little known about the experiences of students in further and higher education in Ireland. So that was the general sort of impact, but how does this differ by social class? The work by our ESRI colleagues suggested that DESH schools were reporting much more problems with lower engagement and in access to devices and broadband. They also were able to look at the access issues by the characteristics of the area where the school is based, and again found that there was a wide digital divide in areas of disadvantage. In the UK, they found that the gap in terms of the amount of time spent on learning at home was very significant, and if that's accumulating over a long period of closure, that's going to add up to a very wide gap. We also draw on, in our review, we draw on previous research which looks at summer learning loss and the effects of previous school closures due to things like teachers' strikes. Much of this is in the US, but what it does show is that the impact of these closures is greater for disadvantaged students, for lower achieving students, and in disadvantaged schools. I suppose the scale of the current closures are unprecedented. Those in that past research, there's very few cases where the closures were this long or this widespread. So there's good bit of evidence around formal education, but obviously learning also takes lots of other forms, and there's also inequalities in access to informal learning opportunities, and we know that for disadvantaged children this is more likely to take place with school support, and therefore that closures are likely to widen that gap as well. There is also evidence of other disadvantaged groups that are being disadvantaged more by the closures. So students with special educational needs, and here we're drawing on, in the study we draw on research by Inclusion Ireland and Barron and Emmett. So which show very clearly that the remote learning can be very challenging for those with behavioural, attention or intellectual difficulties. Obviously the additional supports and structures for those children, like therapy appointments, are also cancelled, and there's the referrals that are often made through schools are obviously also stopping. The Inclusion Ireland study also showed that parents felt that they lacked suitable educational materials for helping with their children's learning. There's a lack of information so far to date on the experience of migrant children, but what we do know is that from pre-COVID research is that parents, especially for those with who don't have an English-speaking background, face greater challenges in accessing information from schools. So that's likely to have been exacerbation for that group. Sorry. So going on to the transitions to further and higher education and the labour market. First, looking at youth employment, as the Minister was referring to, the sectors that have been worst hit by the pandemic are those ones that are most youth friendly, where employment of young people is concentrated, such as retail and hospitality. And this has meant that young people are overrepresented in job loss figures. And the difference between the current situation and recessions in the past is that emigration is not the usual safety valve that it can be. So just looking at some figures here that were published in the ESRI QEC recently, shows the pandemic unemployment claimants as a proportion of employment levels in the last quarter of 2019. So this shows that 60% of 18 and 19-year-olds had lost their jobs, compared to 26% overall. And also you see also there the 20 to 24-year-olds with 50% of those experiencing job loss. So there's a very severe impact for these age groups. There's also disruption, obviously, to apprenticeships and on the job training there. At the EU level, CEDEFOP have said there's been quite a piecemeal approach to this in terms of switching to online training for this group. They noted that in Ireland this had occurred for some of the newer apprenticeships, but less so in the traditional ones. We also know quite a lot, and there's a lot of evidence from previous recessions about the impacts on young people. So we know overall young people are more at risk of unemployment, but within that, certain groups are more disadvantaged. So those from lower educational backgrounds, in particular, early school leavers, are hardest hit. There's also, as Emer mentioned, a lot of evidence that unemployment early in your career and entering the labour market during a recession has long-term scarring effects on earnings, on occupational attainment, and even things like job satisfaction and well-being longer term. So this occurs even for the people who manage to find a job, that they can be on a longer term trajectory that has costs for them. So for those who are transitioning to further education and higher education, there's obviously also a range of difficulties. We know, again, from previous research, including the ESRI study on youth reach, that education and training for the most marginalised groups is built on establishing trust between the young people and tutors. So that's going to be much more difficult in the absence of face-to-face contact. For those progressing to higher education, there's a big issue around financing that. So from the Growing Up in Ireland study, we know that 44% of the 20-year-olds were using part-time earnings to fund their studies. So in the absence of employment opportunities, that's going to be much more difficult. And also, many of those students will not be eligible for the income supports because they aren't there for seasonal workers. And obviously, the loss of parental income is also an issue, as that's another very important area of funding. In addition to these challenges, applicants are obviously facing a lot of uncertainty about the new arrangements for teaching and learning at third level, and even their likelihood, I suppose, of gaining entry. So to wrap up in terms of the lessons for further research and some conclusions, I suppose our review, although there's a lot of research coming out and it's growing day by day, there's still a lack of systematic evidence on the impact on children and young people in Ireland. And Emer highlighted some of the areas where there's really nothing to date around for young people in particular, around physical activity or diet and mental health. Also, it's important, obviously, to capture medium-term effects as we develop policies. So there's obviously all the immediate impact is important, but obviously we need to know about what those longer-term effects are as well. The Growing Up in Ireland offers great potential, I think, for undertaking research on these issues, and there's potential for running surveys that actually are specifically about COVID for the two cohorts. As it happens, both these groups are at very important points in their transition. So the younger cohort are just entering second level education, and the older cohort are just entering the labour market. So this could provide nationally representative data for these groups, and the size of the sample, I suppose, would allow us to look not only at the average patterns, but also at variations between groups in the direct and indirect effects of the pandemic. So, as I say, some groups where we have very little information to date, like children in migrant families. In terms of what conclusions we can draw from the overview of the research, there does seem to be evidence of widening pre-COVID patterns of inequality across the whole range of outcomes. There seems to be very significant learning loss, especially among the disadvantaged and students with special educational needs. There is, we think, a real risk of dropout from school amongst those who have become disengaged during distance learning. There's also widespread evidence, I suppose, that both from previous recessions and the emerging evidence that children will be affected by the increases in parental stress, and that is likely to persist if high unemployment persists, and with the phasing out of some of those income supports. And as I say, we've got a wide body of evidence of the negative impact of previous recession on children's socio-emotional and educational development. So the longer those economic effects go on, the bigger the impact we would expect on children. So obviously, in policy terms, much of the initial focus has been on the logistics of the return to school and getting children back into early years provision. But I think the research highlights that there's an urgent need to address a range of other issues. So firstly, the learning loss that's occurring and is accruing for particularly disadvantaged groups. We know that the interventions that work best for this is a greater one-to-one tuition and small group supports that are needed to address this widening gap and to allow those groups to catch up. So that will require significant resources, and it's something that needs to be ongoing. So it's not going to be bridged by a week or two of summer support. There's also significant needs for additional supports for young people and children with SEN to assist their readjustment to education. Obviously, supports needed for the ongoing viability of the early years sector. We haven't really had time to go into that in the current presentation, but that's obviously an area where there is a need for ongoing supports. In terms of the social emotional difficulties that are emerging, there's a need for both within school and therapeutic supports. And as Emer mentioned, these were already under pressure pre-COVID, so the demand is going to be even greater now for those supports. There's also an urgent need to provide supports for youth transitions into the labour market. We have a lot of pre-existing research about what works best in this area in terms of the types of training and active labour market policies that are needed, in particular ones that are job specific, that training is job specific and involves employers or recognises employers' needs. There needs to be incentives to employers to recruit apprentices, and I suppose the ILO has recommended the need for broader stimuluses for youth employment, so that there's including wage subsidies to employers to take on young people and give them work experience and training. So I am going to wrap up there, and I will hand back to Alan.
Thanks so much, Helen. Thanks to Emer as well, and indeed thanks to Marika, who, of course, one of the authors of the study. I said it to the team when I read this report a number of weeks ago. I think you've done a pretty amazing job at bringing so much material together so quickly. I knew the study was being done, but I had underestimated the amount of progress that you were actually going to make. So congratulations on that. And in case I didn't say it earlier on, I mean, generally, obviously, I want to thank the DCYA for funding this research and engaging with us. And I always say it's not just about the funding. At the Institute, we're trying to do work that's as policy relevant as possible. So it's always good to be having ongoing conversations with the policymakers to know what are the issues that they're trying to tackle. And in that context, I want to thank colleagues Dermot Ryan and Anna Visser at the DCYA for their engagement over this joint research program. Okay, so another point that has been made earlier on is that the sort of issues that are being highlighted very much demand an all of government response. Obviously, the issues go beyond any single department. And in that context, we were eager to have a couple of folks to input into the discussion from other departments. So in that context, I'm going to call on Tom O'Brien first. So Tom is the program manager in the mental health unit at the Department of Health. Obviously a lot of relevant issues, Tom, have been mentioned so far. So Tom, do you want to take a few minutes to give us some, share some thoughts?
Yeah, I can do that. And I'll also try, thanks Alan, to share a bit of screen if I can. So as you know, we have been working in the department, and just last month, the Department of Health launched our revised mental health policy, which was 17th of June. We do know, and thanks for the report, because what it highlights are things that were already existing in terms of disadvantage and equity of access, inequalities in the system. And of course, COVID accelerates those issues, and we know now that an awful lot of issues arising, such as alcohol use and domestic violence, diet, anxiety, they're all beginning to grow as people deal with isolation on top of all of the other issues that are there. What I can say is that we launched this policy with I suppose, a great deal of concern around this whole of government approach, knowing that mental health is not the domain of health alone, because we can't deal with homelessness as a health department, or we can't deal with access to employment as a health department. So the whole working group and the oversight group within the policy decided that this whole of government approach was necessary. So just to highlight that, feeding into that report was our own National Youth Mental Health Task Force report, which was launched, I think, December 2017. And again, this was a huge stakeholder piece that we did with all age groups, feeding into the My World survey as well at the time, and looking at some of the ERSI reports at the time. And we did highlight an awful lot of the issues that you've mentioned this morning, and they fed into our report. So again, looking at the determinants of health, we knew that there was an awful lot of things that feed into what makes a person's mental health become poor, and that it wasn't just around their health requirements, but there was an awful lot of determinants there as well. So we decided then as a department that the best thing to do would be to look at outcomes rather than looking at the costs of beds, the numbers of staff. We wanted to find out what would the outcome be for the individual going into a service seeking whatever it is that they wanted. So we looked at domains around promotion, prevention, early intervention. We looked at service access, coordination, and continuity of care. We looked at social inclusion. And by social inclusion, it wasn't that you were a traveller or that you were a migrant. It was more that what is it about my mental health that makes me even further socially excluded? So when I go to get a payment because I've been on sick leave, is that exasperated by the mechanisms that are in place, and what gets you back to work quicker, or what makes your mental health worse if you don't get some sort of understanding around your mental health condition? And then the domain 4, which was new to the Vision for Change policy, Domain 4 looked at, well, the accountability of service provision, and then making sure that there was continuous improvement, because this is, again, another 10-year policy. So we're looking at enablers over that 10-year period to help people benefit from their services for mental health. And again, the services for mental health aren't around clinical. I think the first Vision for Change policy was a little towards the kind of clinical provisions required from a health setting. But what we've looked at here is what you've been talking about, is that an awful lot of people can be dealt with at an early stage through mental health, well-being, education, prevention, and that if we can allow people access to services quite quickly, well then that mental health problem may not get worse as time goes on, as you wait for a waiting list. So again, we looked at what was there in terms of NGOs and utilizing an awful lot of the expertise that's there outside of just the HSE. So it's the HSE funded agencies like Jigsaw and MyMind to develop things like online cognitive behavior therapy, online dialectic behavior therapy, peer networks, for example. So again, looking at what's there through all of the agencies funded through the HSE and within the HSE system, and then looking at how we can allow people access to those as quickly as possible. So even this year, the department have launched a telephone line for signposting. So again, if you ring the telephone line, you can find out what it is that your issue is and be redirected to the appropriate service that's there for you, because there are thousands of them, and a lot of the time people just didn't know where to go. And again, the people-to-people support is recognizing the ability of counselling. And we've launched an awful lot of online counselling, which seems to be working quite well at the moment during COVID. People are accessing it and people's issues are being dealt with online. And again, what that means is there's an awful lot of follow-up, and there's online data that we can gather. A national crisis text line has been launched with the HSE for people to text in, for young people to text in their concerns. And again, that's going to gather data on what types of issues are emerging for people, and then what does the government need to do to work together. We're looking at primary care access, we're looking at the voluntary community sector, and we're looking at specialist mental health services and making sure that they're built better for these tiered approaches to accessing services. So the policy is online on the Department of Health online. We did look at stakeholders. We had a huge stakeholder consultation process, and we did listen to people around what they wanted in terms of their priorities for mental health. And an awful lot of it, again, was what you've been talking about in your report. So again, all the outcomes were based on what it is that I can get as a service user going into a service, and how can I measure the quality of that service when I come out of the service. So we've looked at how we could quantify that, and one of the main research or one of the main recommendations in the report is research, that we need a lot more of it in terms of mental health, because we haven't done so much as we could have in mental health arena. So the idea is that the vision would be a continuum of mental health services and pathways where you could self-refer, where you could be referred through primary care, when you could be referred through from community mental health teams, developing new services such as out-of-hours crisis cafes where you can go and wait with a counsellor and get support until the accident emergency rooms are available, linking in with hospitals, digital health interventions which seem to be working. Social prescribing is a big thing again. How can we help people get into sport? How can we help them get access to computers, as you talked about? How can we help with peer networks? So again, it's dealing with all of the professionalism and all of the skill set that is already there. But again, it's not just a Department of Health issue. So again, it's looking at our colleagues, working with our colleagues in children, and with Brendan's colleagues more recently in education. We've been looking at, again, how we can work together rather than work in isolation to deliver mental health services. So the main themes in the policy were flexible working among clinical teams and with NGOs outside of the HSE sector, looking at how we can better build services for 0 to 25, understanding that at 18, sometimes things just completely stop, and then you're possibly waiting to get into an adult service, but we're looking at that transition period. Again, one of the biggest things is looking at dual diagnosis and understanding that addiction, although it's currently under primary care at the moment, it has mental health connotations. Obviously it does. So we need to take account of those things and ensure that access for somebody with an addiction problem is not as problematic as it has been. We're looking at quality and oversight, and we do have a National Implementation Monitoring Committee to be established over the next 10 years, and they'll be looking to drive all of the recommendations. There are 100 of them, and they're building on the Vision for Change policy, which is there, and we're looking at social inclusion. So I suppose that is it in a nutshell. So again, just to say, we are working quite well with other departments, which we hadn't been doing, hands up, ourselves as much as we should have been. We are looking at the ERSI research and other research areas and wondering what priorities are coming up that maybe we haven't considered. And then we are looking then at the National Implementation Monitoring Committee to develop all of these things and work together on a whole of government basis.
Great, thanks so much for that. Alan. Yeah, no, thanks so much, Tom. That was a fascinating addition to the deliberations. And again, I've no doubt these conversations are going to carry on for quite a while. Can I move over to Brendan Doody now? So Brendan is the Assistant Chief Inspector with the Department of Education, and obviously great to get the perspective of the Department of Education. So sincere thanks, Brendan. We'll look forward to your
Thanks very much, Alan. And unfortunately, I don't have a screen to share, so you're just going to have to bear with this visual, if that's okay. And I just want to start by offering my thanks for the opportunity to attend the launch today, and just to provide a brief overview of some of the policy-related developments arising from the period of school closures. And obviously, I want to congratulate the SRI for the excellent work in pulling together the key messages contained in the report. You've referenced that yourself, Alan. It's an incredible job to pull all of the messages together in such a short space of time. And I suppose the findings for us are both significant and important. And they very much add to the overall body of knowledge that's available to the department in determining how we best configure supports and resources such that we meet the needs of all the learners in the education system. But I suppose just to start, you know, there's no doubt but that the COVID-19 related closure of all schools in March last, it really did present a very significant series of challenges across the education sector. And as referenced in the report, in the ESRI report, I mean, there is no comparable precedent for this development, and therefore, like, there's no blueprint immediately available to the department as to how best proceed. And in that regard, I think it's important to note that we face the same or at least similar challenges to those being faced by education systems across Europe and further afield, in fact. But the findings contained in the report, I mean, they address many issues experienced by young people during school closures. And from an education perspective, the report rightly emphasizes key issues associated with school closures. The critical importance of supported transition programs and measures to mitigate regression in learning, to name just two. But in seeking to deal with these and other issues, the department's prime consideration, I think this is really important to state, has been it's been the interest of students and their families, as well as the safety of the staff in the sector. And it's worth emphasizing that the department took definitive decisions to involve all stakeholders in developing the actions and the policies to tackle the challenges raised by COVID-19. So actions that were undertaken, they were progressed when they had been thoroughly considered and when the practicalities were discussed with students, with parents, with teachers, school leaders and managers of schools. So for example, guidance documents, which I'll refer to later, they were issued to schools, and they were developed by a group of department officials and inspectors working alongside representatives of those bodies, the students, the parents, the teachers, the school managers. Summer programs, similarly, for children with special education needs, developed with stakeholder representatives, and the calculated grades model, published only when agreed with the student and other stakeholders. And I suppose, look, you know, this might have left the department open at times to criticism that nothing was being done, but in fact intensive work was underway, and it achieved the buy-in and support from students and parents groups and teacher unions and school management, and a similar process and approach is underway regarding the reopening of schools. But over the next couple of minutes, I'll refer to developments as they relate to students at most risk of educational disadvantage or those with special education needs. These being the key issues identified in the ESI report. So a very significant amount of work has gone into supporting schools to get these elements of young people's experiences of schools aligned as correctly as possible in the circumstances. And it's really important, I suppose, to note that nothing is ever going to be the perfect response. It's to try and get things as aligned as correctly as possible in these circumstances. And in that regard, a number of measures have been put in place by the department, and these include the provision of a broad suite of guidance documents for schools aimed at supporting them to meet the needs of students. I'll expand on that work presently. The Department Social Inclusion Unit took the decision to pay in advance the 2020-2021 DESH grant to schools to help them to support students most at risk of educational disadvantage. There's also been considerable liaison with other government departments, as Tom has mentioned there, is critically important. And in seeking to provide for those, again, correctly identified in the ESRI report, most at risk of educational disadvantage. So, for example, the continuation of the Department of Employment Affairs and Social Protection funded school meals programme through the Easter and the summer holiday period. That's just one example, I suppose, of that liaison. Again, as recognised in the ESRI report, it's critically important that young people and their teachers are supported to ensure their well-being. And in that regard, colleagues in the National Educational Psychological Service, they've been leading on the development of support and advice for schools in the area of well-being. The resources, they've been made available to the school system on the Department of Education's website, and that work is ongoing, and further work will be done to support schools as they reopen. But we also know that for many teachers, there was a challenge in moving to the delivery of learning opportunities to students in the online world. They haven't been trained for that in many respects. For that reason, colleagues in teacher support services, the PDST, JCT, NCSE, for example, they've made significant efforts to move their online platforms, to move their learning platforms online and to support teachers' efforts to provide the best possible learning opportunities for students in this new context. And clearly, there's been a lot of interest among teachers in accessing this new form of training. One good example of this, for example, was the attendance at a joint PDST Teaching Council online webinar on special education needs, where just over 3,000 people attended. It's also really important to note that the department has significantly expanded the summer programme offered to students with SEN and those at risk of educational disadvantage. And I'll offer a little bit more detail on that in a minute or two. But I'd just like to focus now in some more detail on two of the measures I just referenced: the suite of guidance documents that was provided to schools by the department to support continuity in learning, and the summer programme for children with special education needs and for those at risk of educational disadvantage. So in terms of guidance, advice and guidance issued to the school sector following the school closures. So all schools were asked to work to minimise the impact on teaching and learning by continuing to plan lessons and where possible, provide online resources for students or online lessons where schools were equipped to do so. Schools were asked to be conscious of students that may not have access to online facilities and to consider this actively in their plans. Information was provided to teachers on a range of online resources to assist schools to provide ongoing support to students during school closures. And following the decision that schools would remain closed after the initial period, further detailed guidance issued to all schools on supporting teaching and learning. Now, specific guidance was also issued for those engaging with students with special education needs and those at risk of educational disadvantage. The guidance was developed on foot of information available to the department from a range of sources, including research conducted by third-level institutions, National Parents Council, for example, and also from information arising from contacts with schools by the inspectorate. But between Easter and the commencement of the summer holiday period, the inspectorate contacted schools with a view to finding out largely two things. Firstly, they wanted to find out what schools were experiencing in terms of the challenges, but also to find out what measures were working well. And very much in line with the ESRI findings, the inspectorate contacts with schools suggested that while many children adapted reasonably well to the new circumstances, the absence of school and other supports was reported as having a negative impact on the lives and well-being of many children, particularly for those with complex needs. The loss of regular school routine, social interaction with friends, access to teachers, special needs assistance, therapy services, and respite type supports presented a real risk of regression in learning, the social and emotional development, and the well-being of these children. Again, this is very much in line with your own findings in your report. However, we also asked schools to identify what was working well, such that we could share that with all schools. A similar approach was followed in producing guidance for students at risk of educational disadvantage. Now, sorry, just bear with me 1 second. Sorry. We asked the schools to tell us what worked, and we shared these exemplars of effective practice in the guidance that issued to all schools. Now, all of those guidance documents for schools have been made available on the department's website. Finally, I'd just like to refer to the range of programs that have been made available to schools and to students this summer. So Summer Provision 2020, Reconnecting with Education, as we're calling it, it's a significantly expanded program for children with complex special education needs and for those at greatest risk of educational disadvantage. So as many of you may know, the summer program comprises a Department of Education-led program for children with special education needs, involving both a school-based strand and a home-based strand. The program focuses on providing a foundation to re-establishing relationships, a sense of belonging and connectedness to the schools, to re-engaging with learning and support, and the successful transition or reintegration of students with their peers into their planned education setting for the next school year. Typically, about 10,000 students avail of what has been known heretofore as the July programme, 15,000 students are availing of the program this year. Also, we have a very significantly expanded program available to DESH schools. So each year, typically, approximately 70 DESH Band 1 primary schools provide literacy and numeracy summer camps to pupils at most risk of educational disadvantage. This program has been significantly expanded and can be offered by all primary schools in the DESH program. And those include the DESH Band 2 and DESH rural schools. And we've provided comprehensive guidance to support schools in their work. And it's really positive to note that 221 schools have chosen to provide this literacy and numeracy summer camps this year, and that's going to cater for about 7,000 students. An entirely new program has been introduced for DESH post-primary schools as a direct consequence of the school closures, and specifically the challenge faced by post-primary schools in reconnecting some of their learners to learning and to the school. The program is offered over a week during the summer, and it's targeted at those identified by the school as being most at risk of educational disadvantage. And again, really pleasing to note there's very strong interest in the DESH post-primary school sector, and about 80 of them have chosen to provide that program. So in conclusion, I hope I've given you a flavour of the range of initiatives and measures that the department has either introduced or expanded upon as a result of the challenges facing the education system arising from COVID-19. The ESRI report and other research identifies the extent of those challenges. And as a final word, I can assure those in attendance today that we're working hard to try to support schools in as many ways as we can to assist them in meeting the needs of all learners, but particularly those who are most at risk. We're also working hard to try to ensure the return of all students to school on a full-time basis from the beginning of the next school year. And obviously there are many challenges in that regard. We feel that the best way to address those and the challenges identified in the report is to get students back to school. And I suppose the pandemic has taught us, if we ever needed to learn it, that schools perform a whole range of social, emotional and health functions, as well as providing opportunities for academic learning. Indeed, for some of the children, we know that school is a safe place and a vital sanctuary. That's why the department and Minister Foley are entirely focused on resumption of schooling safely for all students, because the best way to address the needs identified in the report is to resume schooling. And the Minister has also recognised that this will require significant investment, and this is being worked on currently. So thank you very much for your attention.
Thanks so much for that, Brendan. Really helpful and again insightful. Now we've a few minutes for questions, maybe about 10 minutes, and some people have already provided some questions through the Q&A function. So I'll do my best to get to as many of these as possible. So I'm going to get straight into them. And the first questioner is Robert Murta from Inclusion Ireland, and I'm going to paraphrase the question, but the issue here is around the government's role in providing technology and supports to families and children. So I think we've had a lot of discussion about patchy broadband, if I can put it like that. Some kids not having devices. And I suppose there's a question maybe to Emer on what should the role of government be at this stage in terms of providing the technologies to students, and maybe I don't know, has it to be done in a targeted way. And Brendan, if you wouldn't mind inputting on this question too, this strikes me as a really tricky one, in the sense that if all the kids go back to school in September and stay in school, maybe the digital divide is less of a problem. But if we find the schools are out again, well, then it's an enormous problem. And I suppose it's almost like from your perspective in public administration, how is the government going to deal with this technology issue? So Emer, do you want to provide some comments first?
Sure, Alan, thanks. And just to note, as Brendan I'm sure would say, that there was additional provision for devices offered to DESH schools during the midst of the pandemic. I mean, there is a broader issue. I think it's twofold. There's the high-speed broadband, which obviously is part of the more general concern of the National Broadband Plan. And then there's the devices, because it wasn't just that some families didn't have devices, but also the issue of having enough devices where parents were also working from home. So I think there will be inequities going forward if there is still online learning at primary and second level. You'll have seen the announcement from the Department of Further and Higher Education around money for devices for their sectors, because it looks like so far at least the third level institutions have said they've moved to blended learning. So, I mean, it is a real issue and will require a good deal of investment, but I think some of the other issues we've raised around learning loss and around socio-emotional supports are possibly even more important.
And Brendan, do you want to comment at all on that logistical point that I've raised as to how is the department to plan in a context where, you know, we don't know if the schools, well, we hope the schools will be reopening, but there is this danger that you could have an open shut situation.
Yeah, I mean, look, obviously the ideal is that everybody is back in school and everybody is face-to-face with the teacher, but that may not necessarily be the case. And I suppose what is really important to note is that there is a view out there that teenagers are young people and teenagers are very comfortable using IT, and they're very savvy, tech savvy and all that type of thing. And yes, if my own teenagers are anything to go by, they're very comfortable using TikTok and other stuff like that. But they mightn't necessarily be as tech savvy in use of online learning platforms as we may have previously thought. So there is support required for students, for schools in the first instance, to actually enable students to use online learning platforms as effectively as possible. And guidance is being prepared on that particular aspect of school life at the moment. But the other aspect is training for teachers. Teachers simply haven't been, you know, it isn't part of initial teacher education. And I suppose if you had said in maybe November, December last year, you know, on the off chance that there's going to be a global pandemic that's going to close the entire school system, can you prepare everything that needs to be prepared? And critical among all of those measures would be training for teachers. And there is a recognition that additional training for teachers is required. And I know the colleagues in PDST in particular, they're working flat out in terms of building the capacity of the system to deliver in that remote learning environment if it is needed. And as I say, hopefully the position will be that schools will be able to open as they might have looked like in March last year. So we also know from our engagement with, we managed to contact about 62% of all schools in that period between Easter and the summer, in that process of trying to find out, well, what's working and what has proved challenging for you in many respects. So in making those connections with schools, we discovered all sorts of really, really good practice, all sorts of measures that schools had put in place in order to bridge this digital divide, and it is a real thing. And in our guidance to schools, particularly the guidance that was prepared to support schools in their work in meeting the needs of students who are most at risk of educational disadvantage, and the guidance that we prepared for youth reach, learners in the youth reach sector, we identified many of the practices that schools told us that they had utilized. Now, in some instances, and you have to recognize that it's possible in some circumstances, it wasn't possible in many other circumstances. But in some DESH schools, for example, they tapped into, very effectively, they tapped into local agencies, local communities, in order to ensure that devices were provided to learners in their homes. And the final point I would make is that we cannot equate a mobile phone with an appropriate, as being an appropriate digital device. You know, there are circumstances where young people have access to things on their phone immediately, and that's fine and well, but it is no substitute for an effective online learning platform, and certainly there are things to be considered in that regard. But the additional funding that was provided to DESH schools, for example, in the context of the overall ICT grant, it should go some way in order to assist schools in that regard. So, I mean, we'd have seen on news programs and in newspapers over the last while, schools working really effectively to try and ensure that the learners, and I suppose it might most have been in the students studying for Leaving Cert or state exams sector, you know, that they were able to work really effectively and leverage the benefit of really effective relations with agencies in the local area to provide some of those devices.
Okay, thanks for that. There's sort of a related question. We've discussed there the needs of the sort of additional technical supports for students. But we have another question in here from Vivian Parry, which is really asking about social and emotional supports for students. And I wonder, Tom, could I put that to you in the context of the Department of Health and Mental Health? Ideally, like, should you have direct access to schools, be it through guidance counsellors or others? And, you know, should the Department of Health be thinking in terms of proactively running mental health programs in schools?
Well, I think the Department of Education have their own services, and they have their own psychological services that are working quite well. What we've been doing is we've been working with the department then on developing additional supports. So, you know, these are supports that are available to anybody. You don't need to be a school person to go there. So what we've done during the COVID pandemic is we've invested heavily in online supports, which are free to people, such as online counselling, the crisis text line, telephone support lines. What you mentioned, which is quite valid, is what do you do if you don't have access to broadband? So what we've done from the department's point of view is we've worked with the HSE then to ensure that people can get support or access to online support and online therapy in their primary care centres, because most primary care centres would have some sort of working broadband, which is quite good. On top of that, then you have your traditional primary care teams, your mental health care teams. They're done on a referral process once, I suppose, the Department of Education, once their NEPS teams feel that it's important to get additional supports, well, then those referrals can happen, and then they happen in the normal route through either your GP or going through your primary care support. So they're there, they just need to be ramped up, and access needs to be a little bit clearer. So I think the main issue has been signposting, and where do people go when they need something. That has been a very big problem. So all of the support services, whether they're HSE or HSE funded services, they're available on www.mymentalhealth.ie. And you can go in there and search for support services based on your age profile or your catchment area. And again, you can access services there. But going back to your original question, Alan, we are working very closely with the Department of Education, our colleagues there, and with children in a way that we haven't really done before. So now we're speaking to each other. And for example, the Health and Wellbeing Psychosocial team has been established for COVID-19 in the HSE. And I know that Deirdre McHugh in the Department of Education has been working on a paper that has been submitted in to that team again, so that we're all singing from the same hymn sheet and not getting confused and tripping over each other and duplicating services. So that's something I think where it's a very positive change in this sharing the workload emphasis, which is happening now.
Very good. Now, unfortunately, we are close to the end, but there is one additional question that I wanted to get in, and I'll just read it. It's about lone parents. So what resources and support would you propose to alleviate the burden of lone parents who are disproportionately affected by the double care burden mentioned, and ensuring that children of one-parent homes are not suffering from a lack of formal learning because of the burden? So I don't know, maybe either Helen or Emer, if you want to reflect on that, the sort of additional considerations for lone parents and by extension the children of lone parents.
Yeah, I can come in there. Yeah, I think for lone parents, the issue of that double burden is crucial, and we've seen, from previous research, that sort of work-family conflict can be particularly difficult for people parenting alone. So I think childcare support is going to be really crucial here. I mean, we saw from our colleagues who did Paul Redmond, who looked at the essential workers. found that actually a higher proportion of essential workers are lone parents. So having access to childcare supports is crucial. So that's not only for the youngest age group, but that's after school supports as well, which can be particularly patchy, you know, and places that people, you know, that there's I suppose the after school services have provide children with a place where they can undertake their homework as well. You know, that's not always available to children in a disadvantaged situation. So I think prioritising the childcare needs of lone parents is something that needs to be done.
Okay, could be logistically complicated again, depending on circumstances in the autumn. Okay, I did say we would end very close to 1 o'clock, and I think we'll do exactly that. So I'd just like to thank our guests, Tom and Brendan, and of course the Minister. I want to congratulate Helen, Emer, and America once again, and I'd just like to thank everybody who logged on today. So obviously we'll be taking this approach to the dissemination of research results for quite a while. So we'll obviously let everybody know when future events are happening, and we very much hope you can join us again. So with that, I'll bid you all a good day.